Good morning, caregivers. Do you know the truth about nursing homes? Today, I'll share tips with you about things that most caregivers don't know about nursing homes. Stay with me for the caregiving chat of the day. Nursing homes go by a couple of different names. One is nursing home. Two is skilled nursing community. Three is rehabilitation community, and then sometimes they're called long-term care communities. This is the same name for the same place. The rehabilitation community is kind of a new term that nursing homes use that to me is kind of marketing. People don't like the word nursing home. Nobody wants to go to a nursing home, so why not go to a rehab community? And I'll explain the difference. So some of the newer rehab communities only do rehab, which means if someone breaks a hip or has a health issue, you go there for, quote, rehabilitation so that you can go back home. There are other nursing homes that do rehabilitation, but they also do long-term care, which means that people can stay there past insurance dates and sometimes until the end of life. When everyone goes into a nursing home, a rehab, a long-term care community, whatever you want to call it, there's a huge document that you sign. It's probably anywhere from 30 to 60 pages because I've signed them over the years for my clients. Make sure that you read that document because I can tell you there are things in there that you don't have to agree for and that you shouldn't sign. Read the document. Don't just let the staff take you through that document and you're initialing and you're signing and you have no idea what you're signing for. It's very, very important. The next thing is length of stay. And length of stay, when people go to rehab, they think, oh, mom or dad will be there for like a couple of months. We don't have to worry about anything. Not true. Depending on your insurance, whether it's Medicare, you may have Secure Horizons, Blue Cross, Kaiser, your insurance pays for a certain number of days in rehab with the disclaimer that your loved one has to be making, quote, functional progress. Well, what on earth is that? That means that the insurance company reviews progress every 7 days with the nursing home. And the progress has to be, this week, Mrs. Smith walked 50 feet further with a walker. This week, Mrs. Smith was able to dress herself, where last week she wasn't able to dress herself. So for aging adults and for parents who go to these rehab communities and think that they don't have to do anything and all they have to do is lay in bed all day and they get to stay there, not true. They will get discharged. And I can't tell you the number of phone calls I used to receive on Friday at 3 o'clock from family members saying, oh my gosh, my parent, the nursing home is sending them home today and they can't be at home by themselves. It happens the minute that your loved one stops making progress, they will be discharged within the week. So again, rehab is not some Sunny Acres place that you go to do nothing. You actually have to work while you're there to stay as long as possible to make as much progress so that when you go home, you actually can take care of yourself at home, because that's one of the huge risks of having a hip fracture or something serious is your aging parent can't go home alone. Where are they going to live? In your extra bedroom? The other information about nursing homes is, and this is, I think, why people don't like them. My mother instilled in us children, don't ever put me in a nursing home. They do provide medical care and oversight, and honestly, people do need that. So when someone can't stay at home for a number of reasons, a nursing home is an option, but it's never, in my opinion, an ideal option. And here's why. Individuals are left to lay in bed all day. If you don't want to get out of bed, they are not going to make you get out of bed. Loved ones have accidents. Sometimes the accidents aren't cleaned up for hours. If you walk through a nursing home, and it's a good nursing home, you will not smell anything. If you walk through a bad nursing home and you smell things, and you know what I'm talking about, it means that the patients aren't getting timely attention. And the other thing is, the way that a nursing home looks has nothing to do with the care that's provided. The most beautiful nursing homes in the world offer the worst care. I can tell you, I've had clients live there. The nursing homes that may be older and dated, that are clean, that don't have smells, that have really good staff, those are the ones that you want to put your loved one in. So don't let the look of a nursing home sway your decision to put a loved one there. Make sure that you go check them out. Go tour. Take a look. In this video post, there is a link to an article about how to keep loved ones at home and out of nursing homes. Please check it out. Please do comment. Let me know other topics that you'd like to hear. This topic today actually came from a question that I received from someone yesterday. So I can react pretty quickly. If you ask questions and make comments, I'm happy to record the next video on that subject. Tomorrow, we are going to talk about caregiving burnout. I'm Pamela Wilson. I help caregivers and aging adults solve caregiving problems. You can visit my website. It is PamelaDWilson.com. Remember to sign up for my free support group on Saturday, March 2nd. Details are on my website. And I will see you tomorrow in another video. Again, please send me ideas that you would like to hear me speak about, and I will see you then. Have a great day.